Welcome back, everyone. While it takes a village to raise a child, it also takes a community to help educate them on drug and alcohol abuse.
Joining us now in this sponsored interview is Laura-Lee Gasho from Bonneville Communities That Care with how they are helping in northern Utah. And Laura-Lee, you say you want people to know that prevention does work, but it takes a community like this coalition. You got together 12 years ago. Tell us why and what's happened since then.
So we got together when we realized there was a pretty big issue within our Bonneville community. That community is Riverdale, Uinta, South Ogden, and Washington Terrace. So there's a pretty big drug issue within our schools. And Bonneville Communities That Care came together in response to that drug issue with the goal of sending prevention messages throughout the community, having kids talk to their parents, having parents talk to their kids about drugs and at an earlier age, and what we can do to kind of help our kids grow up healthy and successful and away from drugs.
Who is in this coalition and what's the makeup and where are we going? Are we in schools throughout the community?
Yes, so the makeup is, actually our community is really unique. We have key leaders from each of our 4 cities, whether it's a mayor or a community council member. We have representatives from our school district, our health district, our mental health servicing provider, Weber Mental Health, and then we have youth, parents, teachers, the administration from the schools. Everyone kind of comes together collectively to figure out the best path forward for prevention for our kids.
And this wasn't just about decreasing the number of students who are using drugs and alcohol, but this was about preventing this from getting started in the first place. Mm-hmm. How's it been going over the last decade?
It's actually going really well. I mean, that's why we're here. We're here to celebrate the progress we've made. So we started out, we use the SHARP survey. So everything we do is data driven. So the SHARP survey is given to kids every other year in schools. And we've been able to track it through data that our numbers are going down. The kids are not using, they're not using as much, they're not using as early. And so we consider that a success.
Absolutely.
What do you think is the key? What has been effective?
I think the key is how well our group works together. The fact that we have so many key leaders from so many parts of our community, the fact that we have a youth group that's getting stronger. I just think that we have a really good relationship with everyone and we're all invested, we're all in on working to prevent drug use for kids.
What's happening at Bonneville High School? What's worked there?
So Bonneville High is, we have our youth group that's based out of Bonneville High. We have our prevention messaging all over Bonneville High. Our administrators in Bonneville High and all the feeder schools have really just jumped on board with helping kids learn about prevention.
You also say there's an anchor room that they've established there where students can go to just get away?
Mm-hmm. So mental health is obviously a big factor in anything that we do these days. So Bonneville High specifically has what's called the anchor room, and it's just basically a calm down room or a zen den where kids can just go when they've had enough to just disconnect for a few minutes and gather themselves and then move on.
And these numbers are amazing, proven to cut the program to cut drug use by 75%, of alcohol use by up to 60%, and tobacco use by 87%.
So that's our BOTBINS life skills, yes, and we teach that in our secondary schools throughout the Bonneville community. It's also going into our elementary schools, but that is definitely a research-based prevention curriculum that we include in our health classes.
Laura-Lee, we're here today to celebrate that what has been happening is working, but to also share the message with other people out there that this can work. Mm-hmm. And there is hope. Mm-hmm. If you see those numbers spiking in your community, that you can do something about it. Mm-hmm.
That you can gather those people in your community that care, that want to do the best things they can for kids, because they're out there in every community, right? We all want to, kids are our future. We want to see them do better and be better. And so you start together, you start with a problem and you solve it and you keep solving it, and you know, as it evolves, you keep going, and hopefully you end up where we are, where we have a solid decrease in our numbers.
And your program and campaign can be a model for other cities who might be struggling with these same issues. So where would they get started?
So they can start with, you can check our website. Bonneville Communities That Care is on Facebook. They can start there. They can start with their local mental health district, their local schools, like whoever. It starts with one, honestly.
And grows from there. Mm-hmm. Yeah, BonnevilleCTC.org for more information, everybody. And like you mentioned, they are on Facebook as well. Thank you so much for sharing that. with our
you for
viewers. We
having me.
appreciate you being here. Our thanks to Bonneville School District for that sponsored interview. Up next, a workout.